So we are going to call our skiagram plate. This plate we call them as skiagram plate. S-K-I-E, skiagram or skiagram plate. So skiagram plate or skiagram plate, the way we use here in medical words, these plates we call them as skiagram plates. We catch the silhouette of the body. That means what the shadows we have, that is caught in here and imprisoned. And this is history. This happened like million times ahead before. Now we are seeing that. So this is old picture that you are seeing here. Now as we understand the pictures, whatever the picture we are seeing here, a house, tree, grass, cows, river, we see that. Similar thing we see in here, not cows, trees, but whatever the things we are seeing here is human parts of the bodies. So whenever you are given here, you have to describe this, what this particular X-ray or skiagram plate is composed or consists of. So there is a pattern and there is a way of decoding these skiagram plates or this particular plates. So we call them as understanding this skiagram plates or understanding radiology. Now we had a machine which looks like this. We call them as X-ray machine, which liberated some molecules, which we call them as particles or X-ray particles, alpha rays or something. We know better than me, maybe. So those particles are projected from a direction, from a source, and that is thrown to that part of the body which we want to see deep inside. And once this particular particle penetrates that part of the body, that particular shadow silhouette, it's caught on a film like this, and then we interpret this particular film or the shadow which is taken. So this is the basic principle. So the shadow which you are catching through this particular plate is kept on the part of the body which you are taking this particular impression of, placed at the back side of it. So if you are taking this particular silhouette or picture of the thorax, you have to keep this particular plate back side here, and you have to throw this light from the front side and catch it, the silhouette on the back side or shadow on the back side. So this is the principle of doing or making this X-ray. So this thing gives us a direction of the particle or how it is coming. So we call this particle is, or the source of the particle from a distance, we call this plates or decode the plate of the directions of the plate. So this particular machine is in front of me and this particular plate is back side to me. So this direction is coming front of side of me and it is going on the back side. So we call them as the view which you are looking at from anterior posterior, because the particle is coming from the anterior side and we are catching the silhouette at the back side. So we call them as AP view. If this particular silhouette, if you are projecting from the lateral side and we are taking a side picture, we call them as lateral view. If it is right side, we call them as right lateral. If it is left side, we call them as left lateral. So we have a view how this particular picture is taken. Now for example, if this particular projections where from these particles are coming are kept on this side, back side, and you are keeping this particular thing in here. So we call them as posterior anterior of the body. Now our body should be in the reference frame, we call them as in anatomical position. So if I say that I am standing in anatomical position, that's the ideal position, and this particular front side is this side and back side is this. That means this is a ventral side, this is a dorsal side of my body. So then after that, in normal anatomical position, then only we just like consider this X-ray plate. This is anterior side, the machine is anterior to me, and if the machine is posterior to me, we call them as posterior. So if the machine is posterior side, projecting or throwing the particle from the back side, we call them as PA view, and if it is coming from anterior side, we call them as AP view, lateral view, etc. So these are the prime two views we are using, AP view, PA view, depending on how we are projecting this. Lateral view, if you are seeing from the side profile, and in between this lateral and AP or PA view, we have in between view, we call them as oblique view. That means this is 90 degree if you are considering this particular axis, and if you are having something in between, that means 45 degree. So if this direction is coming from the obliquely at a 45 degree angle, we call them as oblique view, right oblique, left oblique. So these are the normal views that we come encounter of this particular region. There are several other views as well other than this anterior view, posterior view, oblique views like OM view, something like skyline view, etc., etc. Different views are there. As we graduate higher and higher, we will come across. But in majority or in 90% of cases, we see these three views are predominantly existing as a X-ray sciogram views, right. So, we understand the views over there. Now, once these particular views are coming to it, we have to identify the sides of it. That means which is right side, which is left side. Now, in a film, unless until it is written on it, if it is the right side or left side, we are not going to make any comment, even though we understand this is right, even though if you understand this is left. So, in a sciogram plate, as you are seeing here, there is a word, if you are seeing it, we have a word written on the lead marker over there, we call them as L. The L stands for left. So, that means this particular side of the left side of this profile is taken. So, if this particular L is not written, we are not going to comment whether it is the right side or left side of the individual you are projecting. Similar to this one as well, we have a marking, right. So, it is written R. So, that means right side. So, it is right side and left side depending on there we will be seeing. Now, in this particular film, usually these are the digital films, usually whatever we are getting nowadays. Under to it we have everything of the patient's profile written, the name, age and the word, even this particular patients where they are coming from, even some of them have the address on it. So, everything is written on it in this particular region. So, what you are doing, you are reading this or decoding the X-ray plate of Mr. or Miss this age, atho, something like that. And even this particular referring doctor who is treating this particular patient who has referred, that name is also been written on it. So, we have this particular everything detail related to this particular patient patient initial patient identification is there. In older days when I used to study graduate this digital plates were not there. This particular patient's profile usually was written on the marker pads like right side, names, everything, ward number, everything was written with handwriting on it, right. Nowadays everything is digitalized. So, everything we can see this. Now, once you see this particular X-ray plates, normally for these undergraduates are of two types. There are general X-ray plates, we call them as plain X-ray plates, and other one is special X-ray plates. Now, what do we mean by the general X-ray plates and what do you mean by the special X-ray plates? Now, in a plain X-ray plates or general X-ray plates, what you see here, this particular particles are thrown at us and that is penetrating our body. So, these particles or X-ray particles are penetrating my bodies. Now, I have different compositions of different matters in our body. I have flesh, that means I have muscles, I have bones, I have cartilage, I have soft tissue structures like viscera, organs, etc. So, all these things are penetrated by these particles. Now, as we have these particular different tissue elements, they have different penetrability. So, these alpha particles or these X-ray particles are penetrating at different penetration capacity through these particular tissues that we have. So, this particular viscera or organs which contains this air is completely penetrated by these particular alpha particles or the X-ray particles. And if it is completely penetrated, it takes a particular color shadow. Some of these particular tissues which are dense particles, that means we have the bones, we have the cartilage that are least penetrated by these particular particles. So, this is least participant or least penetrated tissues will take another shades. And in between this complete penetration and in between non-penetration, we have in between as well or medium penetration. So, those fleshes or soft tissue structures, blood vessels, nerve, muscles are having a medial penetrability that takes a different shades. So, whenever you are getting this, these are not color plates, these are black and white or gray and white or black, gray and white mixture of things we are getting. So, we have three shades here. We are getting the black shadows, we are getting ivory white shadows and we are getting something called them as gray shadows. So, these shadows make something. So these are the normal thing that we see in this particular region. We are going to see some bones, cartilages, which is the osseous shadow, which is commonly been taken. Apart from that, we are going to see some of the organs and viscera if they are completely penetrated or partially penetrated, especially like for lungs, we get a silhouette of this. If it is partially penetrated, that's like heart and coverings of the heart, we will be getting some kind of in-between shadows likewise, and we will be getting some kind of like a mixture of things together depending on how this particular organ are placed. Now this makes this particular plate as plain X-ray. Now in addition to that, if you want to see something special, if you are doing something special, we have to see something more that makes this particular X-ray as a special X-ray. Now what is special about it? So if you want to see this particular blood vessels very delicately, if you want to see any artery and the branching of an artery, if you want to see any veins or branching or tributaries of a vein, or if you want to see any hollow organ or viscera, that means stomach, inside of the stomach, small intestine, trachea, esophagus, inside of it, if you want to see that, normal penetrations cannot penetrate and cannot visualize. So you have to take something special to make them visible. Then that particular X-ray becomes special X-ray. That means it is specially something you are seeing apart from these bone shadows, soft tissue shadows and organ or viscera shadows. So those plates which you are doing something special have to put something special on it. So we have some radioactive dyes which we swallow, consume or put through these veins or arteries and run through it, then we take an X-ray, then that particular object becomes visible. We call them as arteriogram, venogram, meal or swallow, all these kind of things. So then if you see this, all of the cavity of the stomach, small intestine, large intestine, lungs, trachea and all these things become visible, then that makes this particular X-ray as a special X-ray. And otherwise, if you are not seeing anything special, that means bone, viscera and everything which is normally visible like this, we call them as general X-ray, just like this. Okay. Now what are the purposes of doing X-ray? Keno amra kori? Why we do the X-rays? To see this interior of the structures, bony structures, cartilage structure, organs or tissue structures, to identify the ossifications of the bones, primary ossification, secondary ossification, bone fusion is there or not, any diseases of bone is there or not, any diseases of this union of is there or not, any problem with the joints or articulations or is there a problem having or not, etc., etc. We do that for the determinations of the age or union of the bone have happened or not. These are the purpose. That's what we normally do this particular sciogram or X-ray plates of. So to start with this, these are the uses of X-ray that we are talking about to identify these bony tissues, identify age assessments, we understand this particular organs or viscera inside to it. If you want to see, we have to do something contrast radiograph. That means this is spatial. So this is what we are seeing here is the tissues that we are talking about. So light is thrown and this is penetrating a particular joint. Now there are three different types of colors we are seeing here: ivory white, black and gray. So what takes this ivory white over here is the bone, because this is least penetrable. So we call them as radio opaque. It has an opacity, it is not penetrated by the rays. It takes this particular least penetrations on here. The cartilage, which has a little bit less dense, the cartilage present over here in this joint, present in here, that is making some kind of loosened, some penetration is there. This region we have black, that means completely penetrated, because this is outside, this is the air, it is completely penetrated. So this is having a black shadow. Now in between black and white we have a gray zone. You see that? This region, these are the soft tissue region. That means the muscle, the arteries, the veins and etc., etc., nerves, etc., etc., tissues, fascias, everything is there which is present in here. So this is the normal X-ray plate over there we are seeing here, and this belongs to the left side over the body, and this is an elbow joint which is projecting in here. And we have something normal thing will be learning about this particular thing. So, three things we have to consider: white shadow, black shadow and grey shadows, and what makes this particular shadows. Again, these are the views that you are seeing here. Now, how these lights are coming or these particles are coming, we call them as the views. We mentioned about the radiographic views: AP view, PA view, lateral view, oblique view. We understand the meaning of it, how these lights are coming to us and penetrating, and assuming we are standing on normal anatomical position, standing facing this particular thing. This thing, if it is shifted to the back side on my back, and if it is projected from back side, I have to keep the film in front. So, it is penetrating from the back side, then that view will be PA view. Normally, in our examination, we give this particular AP view slides only. So, we usually give AP views only, lateral views only for our examination. Now, if it is belonging to right side or left side of the body, we use this particular element as L or R. We have to mark it. If it is not marked, we are not going to comment, even though we understand. Why? Because if by mistake it can happen, if it is wrongly said, that can lead to bada kand ho gaya. You will be in news. So, being a doctor as well, you have to practice. If you are not very sure, Korean. So, go to the radiologist, mark it right or left, then I am going to talk, because we are not radiologist. So, this mark is important, right and left, right? Because if you make these things, the consequence is that, so unless only it is marked on the X-ray, we are not going to make a comment. What makes this thing special? Now, this is a special slide what you are seeing here. Why? Because you are seeing something special. You are seeing interior of an organ or viscera. You see this particular organ, we call them as stomach. So, this is the stomach, it is how it looks like. It is a J-shaped stomach. This part we call them as fundus of the stomach, this part we call them body, then we have pylorus, then we have the small intestine, duodenum. So, you see that normal X-ray cannot project this particular images like this. This is something special. Why it is special? Because we have put something special on it. So, we spend money on it. So, we buy a barium salt, ask the patient to swallow, the patient swallowed, we know the time it is coming, and then we take a click, and then this picture comes. So, patient will be saying that, Doctor, বেশি পয়সা খরচা করে আমাকে এতগুলো দামি পরীক্ষা করিয়ে দিলেন, কি লাভ হলো? বলে আপনি দেখুন কি দেখতে পারা গেছে, কি সুন্দর জিনিস। হ্যাঁ ডাক্তার, কি দেখা যাচ্ছে? এই দেখা গেল। এইবারে বলি এটা কিসের ম্যাপ? কিসের ম্যাপ দেখা? So, this map is your of stomach, and your stomach has this and this and this. Again, you take time to explain, right? Because more you explain, that's good. Because after all, we are all look for Gandhiji, huh? Gandhiji is the supreme thing that we are going for. So, we call this particular plates as a barium mill or barium swallow X-ray, because we put this particular dye, we call them as barium dye. This we call them as contrast dye. We can use the sodium iodide as well for the veins as well. So, we can visualize the veins, giving some dyes on the veins, arteries, tracheas as well. We can just like give this to see this organ interior, vessel interior like this, which normally X-ray cannot picture us. So, this is a plain X-ray, this is a special X-ray. So, whenever you are given this particular plates, you have to say that this is a plain X-ray or it is a special X-ray. Why it is special? Why it is plain X-ray? We just have to stick to the knowledge and stick to the points on it or logic to it. Now, whenever giving this particular plates, you just like have to start in a manner so that you follow these terms. So, it is a plain or contrast, that is the first thing you have to say. General X-ray or plain X-ray or special, first thing. Alright, go forward. Once you have the view of the X-ray plate, that means AP view, lateral view, oblique view, what you are seeing here. Normally, in all probabilities, undergrad med students, we give AP view or lateral view. PA view, we do not usually give. Regions, what part is visible? That means description of the picture. Whatever you are seeing in this particular picture, that you have to describe. House, trees, leaves, grass, cows, rains, water. That's like you see these things, you have to describe it. And last thing is that bony tissue, soft tissues that you have to say. Bony tissue, if it is bony tissue, that means what, name the bone. Clavicle, then clavicle. Once you know the clavicle, then all of clavicle or half of clavicle. If it is half of clavicle, which half of the clavicle? Medial half or lateral. On this part, if this particular part of this bone is making any joint, that point is visible, then mention the joint that is visible. Soft tissue structure, can you figure out soft tissue structure, anything special about it, which is visible on soft tissue structure? If you cannot see anything special, you say that this is soft tissue structures. If you can figure out what soft tissue structure is, we can say that soft tissue structure of this. For example, this one. This is a soft tissue structure, you can see, of lung. How many lungs we are seeing here? 2, right? Left, right? So if you are seeing something specific soft tissue structure, you mention it. If you are not seeing, প্রথমে কি পয়েন্ট ছিল? এই তো শুরু করো আবার সেই প্রথম থেকে। কি এক্স-রে? কেন প্লেন? লজিক, যা বলবে লজিক থাকতে হবে, আইনজীবীদের মতো, জাস্ট লাইক লয়ার্স ইউ হ্যাভ টু পুট। আপনার জন্য এই এত ধারা, কেন ধারা? আপনি চড় মেরেছেন 302 ধারা, গ্রিভাস হার্ট, তো ওরা যেমন আইনের কথা বলে, তোমার সেই লজিক থাকতে হবে, যেটা আমি বলছি কেন বলছি। সো ইউ হ্যাভ টু আস্ক, এটা আমি বলছি এই কারণে। নাও নেক্সট ইজ, আফটার দিস নেক্সট পয়েন্ট, ভিউ। ওকে, কোন ভিউ? পোস্টেরিয়র অ্যান্টেরিয়র ভিউ না অ্যান্টেরিয়র পোস্টেরিয়র ভিউ? অ্যান্টেরিয়র পোস্টেরিয়র ভিউ আমরা দেবো পরীক্ষার সময়। সো এটা অ্যান্টেরিয়র পোস্টেরিয়র ভিউ। এপি ভিউ, কেন এপি ভিউ? পোস্টেরিয়র সারফেস দেখা যাচ্ছে না, অ্যান্টেরিয়র সারফেস দেখা যাচ্ছে। কি দেখা যাচ্ছে সবার আগে? ক্লাভিকেলটা অ্যান্টেরিয়র থাকে না পোস্টেরিয়র থাকে? তাহলে কি ভিউ হবে? আলোটা কোথা থেকে এসছে, পার্টিকেলটা কোন দিকে এসছে? সামনে থেকে এসছে, পেনিট্রেট করে পিছনে গেছে। এটা উল্টো হলে কি আগে দেখতাম? পিছন দিক দিয়ে হলে বোঝা গেল লজিকটা কোথায়। এরপরে নেক্সট পার্ট, রিজিয়ন। কোন রিজিয়ন? শোল্ডার রিজিয়ন। বনি টিস্যু, সফট টিস্যু। এবারে বলতে থাকে এবারে বনি টিস্যু কি দেখা যাচ্ছে? বেশ, আর কিছু দেখা যাচ্ছে? আর রিবস গুলো দেখা যাচ্ছে। বেশ, আর কি দেখা যাচ্ছে? আর কিছু দেখা যাচ্ছে? আর কিছু দেখা যাচ্ছে না। কি পুরোটা দেখা যাচ্ছে? কোনটা হাফ দেখা যাচ্ছে? হাফ হলে কোনটা হাফ? পুরো হলে পুরো হাফ। আচ্ছা, সেটা তো সেটা বলতে হবে। হলো হলো বেশ, তাহলে কি দেখা যাচ্ছে কি দেখা যাচ্ছে না? এবার জয়েন্ট দেখা যাচ্ছে দেখা যাচ্ছে না? দেখা যাচ্ছে না, দেখা যাচ্ছে। কি জয়েন্ট দেখা যাচ্ছে? শোল্ডার জয়েন্ট। অফ হুইচ সাইড? লেফট সাইড। অ্যাক্রোমিওক্লাভিকুলার জয়েন্ট। অফ হুইচ সাইড? রাইট সাইড। লেফট সাইড, রাইট সাইড। তুই তো রাইটের, তাহলে জয়েন্টস কোনগুলো দেখা যাচ্ছে সেগুলো বলতে হবে, তাই তো? সেগুলো হওয়ার পরে সফট টিস্যু কিছু দেখা যাচ্ছে? কিছু দেখা যাচ্ছে না। এটা কি কালোটা? কেন কালো? হাওয়া আছে, এয়ার পুরো পেনিট্রেট করে বেরিয়ে গেছে। আর সফট টিস্যু আছে? মাংস টাংস আছে? কোনো গায়ে লেগে টেগে আছে? আছে, এদিকে এদিকে আছে, তাই তো? সফট টিস্যু আছে কিছু, আর কালো পার্ট একটা আছে, ঠিক আছে? কোন রিজিয়নে বলা নেই কেন? কোন রিজিয়নে তো আছে। কোন দিক, কোন রিজিয়নে? এটা ফ্র্যাকচার হয়ে গেছে। কোন দিকের? লেফট সাইডে। কি করে বুঝলাম লেফট? লিখা 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 होने से सब कुछ माफ। এবার লিখে দিলে কি সুবিধা? কেন লিখে দিলে বলবো? কারণ লিখে দিলে আমি তো পড়ছি, ভুলটা আমার নয়। আমি পড়তে পারি, আমি পড়ে নিয়েছি। যে লিখেছে সে যদি ভুল করে লিখে থাকে তার ভুল, তাকে ধরুন, আমাকে ধরলে হবে না। আমি হাজতবাস করবো না, কারণ আমি লিখা হ্যাঁ, সুতরাং আমি সেফ। এই কারণেই আমি বলবো। কেমন? এটা কি ভেঙেছে? ক্লাভিকেল কোনখানে ভাঙে? এ কোনখানে ভেঙেছে? যেখানে ভাঙার কথা সেখানেই ভেঙেছে। কোনখানে ভাঙে তাহলে? এইটা মিডিয়াল 2/3 আর ল্যাটারাল 1/3 জাংশন নয়, কে বললো? এটা কোন দিকের? কোন ভিউ? এর কি কিছু অসুবিধা আছে, অসুখ আছে এর কিছু? অসুখ আছে কিছু? আছে? দাঁড়া সবাই বলুক আছে, তবে তো আছে বলবো। আছে? আছে, কি আছে, কি অসুখ আছে? ক্ল্যাভিকেল ভেঙেছে? হিউমেরাস ভেঙেছে। কি ভেঙেছে হিউমেরাসের? নেকটা ভেঙেছে। হিউমেরাসের ঘাড় মটকে গেছে। তো ঘাড় মটকে গেলে কি হয়? নেক অফ দ্য হিউমেরাস ভেঙে গেলে কি হয়? কি থাকে? অ্যাক্সিলারি নার্ভ। অ্যাক্সিলারি নার্ভ ইনজুরি হয়ে যাবে। অ্যাক্সিলারি নার্ভ কাকে সাপ্লাই করে? বাইসেপস ব্র্যাকাইকে করে। ওই দেয়ালটা মাথাটা ঠুকতো। অ্যাক্সিলারি নার্ভ বাইসেপকে করে। কাকে করে? কাকে করে অ্যাক্সিলারি নার্ভ? ওই যে বললাম ক্লাসে, ডেলটয়েড। ডেলটয়েড কোথায় থাকে? কি করে শোল্ডার জয়েন্ট ডেলটয়েড থেকে? কিরকম করে দেখা? অ্যাবডাকশন জিনিসটা কিরকম দেখা? হ্যাঁ, মেরে দে তো একটু। অ্যাবডাকশন, অ্যাবডাকশনের কত থেকে কত ডিগ্রি কে করে? ডেলটয়েড কতটা করে? 15 থেকে 90। তার উপরে কে করবে? আর 15 এর নিচে কে করবে? সুপ্রাস্পাইনেটাস। সুপ্রাস্পাইনেটাসে কোন নার্ভ সাপ্লাই করে? সুপ্রাস্ক্যাপুলার নার্ভ। সুপ্রাস্ক্যাপুলার নার্ভ, এসএসএন। সুপ্রাস্ক্যাপুলার নার্ভ সুপ্রাস্পাইনেটাসকে সাপ্লাই করে দেবে। বেশ, বোঝা গেল কিভাবে পড়তে হবে? सब लिंक्ड लिखा है, सब कुछ सिर्फ लिंक करना पड़ेगा आपको। বোঝা যাচ্ছে না তো? পারবি না তো, কারণ আমরা তো এখনো শিখিনি অতটা। শিখবো তো, কাছে এলে বোঝা যাবে। আউটলাইনটা, মার্জিনটা ইয়ে হয়েছে, কাছে আসতে হবে একটু, বোঝা যাবে। ঠিক আছে, আমরা প্যাথোলজিক্যাল করবো না। কেন করলাম? কারণ এক্সরেতে আমরা এটা দেবো না, কিন্তু আমাদের এই প্রবলেমটা পড়তে হয়। We have to learn this problem of fracture cervical neck of the humerus, consequence of that and what problem it comes with. এই জায়গাটা দেখ, এই কন্টিউরটা অলরেডি চলে গেছে। এটা রাউন্ডেড কন্টিউর থাকে, এটা দেখ কিরকম একটা হয়ে গেছে। ইউজুয়ালি এটা নর্মাল রাউন্ডেড কন্টিউর থাকে। তো দেখে বোঝা যায় যে ফ্র্যাকচার আছে কি নাই। উইথ দিস নচ এরকম হয়ে আছে, মানে ইরেগুলারিটি চলে এসেছে।